I'm Mary Kay Brooks, and I'm a director of special projects at the University of Iowa Hospitals and Clinics. Going back, 15, 16 years when I was actually a staff nurse taking care of patients, I worked in the neurosurgery area and then in the burn trauma area. And so it definitely, you definitely could see the impact of families not having that discussion when a senior member of their family was, really ill, not able to communicate. And, sometimes families would get in fights and arguments about the wishes or what should happen. And I think by having these discussions ahead of time and identifying a family member to kind of be the spokesperson and then communicating with everybody before there's a crisis would have averted some of that. And it's just such a stressful time for folks anyway to then be fighting and at odds. It's just really, hard. It was hard to see that, and you felt bad about it. And then on the opposite side, on the occasions where they did have a plan, it just was so much more, smoother, and people knew what the wishes were. The stress of trying to make those decisions for someone else wasn't there. They could just actually go through the grieving process without, going with the extra drama that could come with that. Personally, I also actually had my own advance directive made, which was a good process for me. And my mother, that's 87, also had one done. And in the process for myself, I learned that my daughter, who at the time was 19, was not ready to be my healthcare agent. So I was able to identify somebody else. And had I not gone through that process, I wouldn't have realized that.
My name is Mercedes Byrne Klug, and I am a daughter and a spouse and a mother, and I'm involved with the Honoring Your Wishes program as a volunteer. I think it's really important for people to stop and recognize that in the event they were in a situation where they couldn't communicate their wishes, and somebody else had to step up to the plate to communicate those wishes, that it's important to give that somebody else, that proxy decision maker, that surrogate decision maker, that healthcare agent, whatever you want to call that person, that you want to give them some kind of guidelines for their own sake. Because people can carry a guilt with them for a long time. People don't want to make the wrong decision on behalf of somebody else. And so, yeah, I think it's really important that if you expect somebody to step up for you when you can't communicate, you owe them to give them an idea of what you're open to and what you're not open to. As a facilitator here at the Senior Center, I've had at least two situations where somebody has made an appointment and they've come in and talked with me, and we go through the script and help think through what their options are and what their wishes are. And then they come back and they bring their healthcare agent with them. And before that second meeting is over, that healthcare agent says, I should be doing this. I should be talking with the person who I'd like to be my healthcare agent. And whenever that happens, I feel like it's a success.
I'm the Reverend Stephen Protzman. I serve the Unitarian Universalist Society here in Iowa City as their minister. I've been here 4 years. I have had my own advanced care plan in place for about 20 years. A long time ago, my partner at the time and I talked about the importance of having our wishes spelled out so we'd know what to do for each other if the need were there. From a professional point of view, it has really deepened my ministry and my relationship with my congregants. There's in society, there's kind of this fear of talking about death, and even though I'm comfortable with the idea myself, I had some fear about that. But getting involved with the advanced care planning kind of challenged me to look it in the face and say, okay, I need to talk about this. And as a result of doing the facilitator training and then facilitating conversations, not only has my own comfort with the topic increased, but relationships with congregants have increased. They've deepened. It's been a very powerful and wonderful experience. When I first did my advanced care planning 20 years ago, my mother and I are close. So along with talking to my partner, I talked with her. I said, Mom, this is a difficult conversation, but I want you to know this is in place, and this is what I want if anything should happen. And then more recently, I turned around and encouraged her to do this work. And we had a great, very powerful conversation, and I felt closer to her for having talked about these things. I think the fact that I'd done the work years ago and opened the conversation and even acknowledged that it's hard to talk about, but it's necessary, and how helpful it is, made it easier. And it's like, Mom, let's have this conversation. I just want to see that you're taken care of.
My name is Sandy Stewart, and I live in Cedar Rapids, but I work here in Iowa City at ACT. Been there for 8 years, and the past 3.5 years I've been the wellness manager at ACT. I think advanced care planning personally just gave me the impetus. The Honoring Your Wishes program really helped me understand the importance of having that document, but also having the conversation about what is in that document. Because I'd never really approached that subject before and never really thought about it. And something you might, you think about doing when you do a will, but advanced care planning is something much more than that. So personally, it just helped me take those steps to complete that process with both myself and my spouse. Going through all those questions to kind of think about that final step of leaving this physical plane here really made you think about just today and living your life every day. It's not just about the future, but it's about how you live your life, and knowing that it could be any day. It could be 30 years from now. It could be tomorrow. So just to appreciate life every day. And I think having that document in place, it's just something you would have just like you'd have a will, advanced care directive, name your beneficiaries for any financial assets you have. It's just taking care of your family and taking care of yourself as well.
My name is Margaret Reese, and I work at Mercy, Iowa City, as the president of the Mercy Hospital Foundation. And I've been involved with Honoring Your Wishes and the Advanced Care Planning Initiative since the beginning.
I am her husband, Dennis, so I have been with her through this process and hearing about her experiences with this and how important it is. We've been married for 15 years.
15. For myself, I do have a plan in place. I have discussed this so many times with Dennis and so many times with my children. They do not want to hear about it again. Do you? Not really. And I have written copies, and everybody has one. My doctor has one. The hospital has one. I presented them to my daughters. We sat down and we talked, and they didn't want to. And I said, this is very important to me. You have to listen, because I do not want my husband, I do not want my children, I don't want anybody in my family to ever be faced with a critical situation and not know what I would want and what they should do. And I don't want to have them live with any doubts in the future of whether or not they made the correct decision for me.
I think just being able to enjoy a few basic essentials is good enough for me, but then when I can't enjoy those anymore, there's very little point. I'll just move on to my next life, reincarnated on Pluto or something, and start anew.
I know it's an awkward conversation. I know our culture isn't comfortable having these conversations, but I really think it's a gift for the people around you who care about you.